Study 12 forced treatment of the mentally ill Ms. FZ and Ms. FG had been involuntarily committed to a psychiatric center. Each was being retained pursuant to orders of the local county court, which had found them to be persons in need of involuntary care and treatment, in that they have a mental illness, for which care and treatment as a patient in a hospital is essential to their welfare, and their judgment is so impaired that they are unable to understand the need for such care and treatment. These patients refused to be medicated with antipsychotic drugs. Their objections were overruled, and they were subsequently medicated with various antipsychotic drugs. Mr. and Ms. FZ thereafter commenced a declaratory judgment action against the commissioner and officials of the psychiatric center. They sought to obtain an injunction against the non-consensual administration of antipsychotic drugs and a declaration of their common law and constitutional right to refuse medication. Ms. FG refused treatment with antipsychotic drugs but was thereafter forcibly medicated. She alleged that the forcible use of antipsychotic medication violated her common law and constitutional right to determine her own course of treatment.
Hello guys, my name is Hesti Susilani Galih. I can explain about definition of mental illness. Mental illness, which are clinically meaningful syndrome or behavior patterns that are associated with distress or suffering and cause interference with one or more functions of human life. There are several symptoms of a mental illness. 1. Feeling uncomfortable. 2. Feeling of insecurity. 3. Lack of confidence. 4. Lack of self-understanding. 5. Lack of satisfaction in social relationship. 6. Immaturity of emotions. 7. His personality is disturbed. 8. Experience pathology in the structure of the nervous system. Treatment of mental illness. Treatment for mental disorder. Treatment for mental illness must be appropriate and appropriate. There are two classes of drugs that are usually used to overcome this problem, namely 1. Antipsychotic drugs. Generation 2, risperidone, olanzapine, quetiapine, clozapine. Generation 1, haloperidol, chlorpromazine, trifluperazine. 2. Anti-anxiety drug. Lorazepam, diazepam, alprazolam, clobazam. Medication must be according to the doctor's prescription and require good control. The question is, should the hospital allow mentally ill patients to determine their own course of treatment? Yes or no? My answer is no, because someone who has a mental illness should not be left alone, but the hospital should not force patients to be given drugs or treatment. The right to reject treatment refers to patients of sound mind. The above-mentioned patients seem to be impaired and to lack the capacity to make a reasoned decision with respect to proposed treatment. Therefore, these patients cannot determine the cause of their treatment, and they should be treated with antipsychotic drug for their best interest. Thank you.